When done correctly, measurement for a posture device makes for a better life for those living with disability. When we assess the client's ranges for sitting, we have to make sure that we use a firm surface for the client to lay on, so that we don't experience any trick movements of the body. Have the client in supine lying with a pillow underneath their head to support their neck. When assessing the pelvis ranges, the client will need to be in supine lying or lying on their back. The therapist will then find a comfortable position next to the client and place their thumbs on the ASIS, anterior superior iliac spine, in order to feel the position of the pelvis when it's moving. To assess the lateral movement of the pelvis, the therapist will elevate the one side of the pelvis while depressing the other side. This will be repeated on both sides. This will help to assess whether the client has one side of the pelvis higher than the other side and whether it's fixed or flexible, as this will affect the seating. The aim of the movement is to try and get the pelvis to neutral. This will indicate the best seating position. If neutral can't be achieved, then accommodations will need to be made to the cushion and other relevant components during seating. To assess the rotation ranges of the pelvis, the therapist will move one side backwards while moving the opposite side forward. This will also be done both ways and will determine whether the client can achieve a neutral range or whether the cushion and relevant components will need to be modified. When assessing the hip ranges, the client will need to be in supine lying or lying on their back. The therapist will need to place their thumb on the ASIS of the side that is being tested, in order to stabilize the pelvis as well as monitor the movement. The reason for this is, when the hip has reached its maximum flexion range, the pelvis will start to tilt backwards, and this will indicate the end of the hip range. With their one hand on the hip, the therapist will use their other hand to grip the knee and move it through its flexion range. Once the client has reached 90 degrees, it means that they have range for sitting. Adduction and abduction is tested by using the same hand placed on the knee to move the knee between the midline and outward to the side, while in a 90-degree position at the hips. This will have to be done on both sides. Flexion and extension of the knee is tested by holding the hip in flexion with the one hand and using the other hand to grip the ankle. The therapist will then move through the knee range between flexion and extension to determine whether there are any limitations that will affect the client's seating. This will have to be done on both sides. With the client lying on their back, the hip and knee can either still be in a flexed position or flat on the bed. The therapist will stabilize the lower leg with one hand and use the other hand with their palm against the bottom of the foot and their fingers around the back of their ankle. They will then move through the plantar and dorsiflexion range of the ankle to determine whether there are any range limitations that will affect seating. This will have to be done on both sides. After the physical assessment of the client's posture in lying, we need to do assessment in sitting to further assess and evaluate the posture. Assess if the pelvis is in neutral range. Check for any obliquity, posterior or anterior tilt, sideways tilt or rotation. In normal alignment, the pelvis should be directly under the shoulders and there should be even weight bearing. The practitioners should always use her or his hands to check and feel if extra force is needed to keep the spine straight aligned. Practitioner assesses to see if the ears, shoulder and hips are all aligned. Explain to the carer how to correctly support the pelvis and then swap places. Check that the spine is upright with the lumbar spine flat. The shoulders should be slightly in front of the hips. There may be no side flexion or rotation of the spine. Therapists assess spinal alignment and also check and feel how much support client would need. The practitioner also needs to check if the head and neck are upright and vertical. If the client's head flops forward, try to keep the corrected spinal alignment and tilt the user back. When measuring a client for a posture support device, it is important to use a firm industrial measurement tape. The practitioner places the measuring tape in line with the client's feet and aligns it in a straight position from feet to the top of the head. It is important that the measuring tape doesn't bend. The practitioner can ask the carer or parent to support with their hands or use book or clipboards next to both sides of the widest part of the thighs and hips. The measurements must be taken from the one side to the other side of the hips with a straight measuring tape. Practitioner measure from behind the buttock to the bend of the knee or popliteal fossa with a straight measuring tape. Practitioner measures from the bend of the knee or popliteal fossa to the feet. Practitioner measures from the seat to the bottom of the elbow bend. Practitioner measure from the outside of the nipple line straight over to the outside of the other nipple line. Practitioner measures from the seat to the apex of the scapula. Practitioner measures from the seat to the top of the shoulder. The practitioner can use clipboards or books as a guide. Practitioner measures from the seat to the occipital area of the head. Practitioner measures from the seat to the top of the head.